Okay, hello everyone. This is one of the three special EUSEM episodes for our HitCast, the official podcast for the Parisian Society of Emergency Medicine. And I'm very honored and pleased to have as a guest today Dr. Eugenia Muresan, who is the education lead for the Young EM Doctors section of EUSEM. Hello, Dr. Muresan. Can you tell us a bit about yourself, about the work you do at the YEMD and what YEMD stands for?
Hi everyone, I'm Eugenia. I'm from Romania, and for the last years, I've been serving as the education lead of the Young Doctor section within USO. We are trying to help young professionals, both in training and immediately after having finished their training, to be more successful in their educational endeavors. We've been organizing face-to-face courses with a brief stop during the pandemic period. They are known as the refresher courses. And we have also been involved in the revision of the ETR for emergency medicine as a way of, again, supporting trainees to achieve their goal of becoming successful professionals.
Thank you. So, since you're the education lead, the questions will be mostly on education. So, the first one, and I'm really interested in this one, where do you think European emergency medicine education stands right now? So, on a scale of very good to not so good, where would you put it? And what would you say are the main things that need to be addressed and improved in the next, let's say, 5 years?
So this will be mostly from a trainee's perspective and a young professional's perspective. I think there is a lot of effort being made by all the parties involved on setting everything on the right path. I had just been part of the Educators Collaborative P-course this morning, and everyone is enthusiastic of in bettering their practice in terms of the educators. There's a lot of information out there, and without a very good structure for your progression, it might be difficult for anybody to succeed. So that's why I believe it is very important in this moment to try to define curriculums and to try to familiarize the residents with what they're supposed to do, what the expectations of them are, and also try to educate the educators in order to properly train and to create functional specialists that can adjust their conduct to the times we are living in. Patients are changing, residents are changing in terms of mentalities and expectations, and we need to keep up with this. So I would not be able to give you grading for the educational system within the emergency medicine in Europe, but the very happy perspective is that everyone is trying at this moment.
That's so great here. And regarding the future, the changing perspectives and so on, you are in contact with a lot of young emergency medicine doctors, both trainees and recent specialists. So how do they see the future of emergency medicine? Is it a hopeful future? Is it a future where they are not sure what their direction is and where the specialty is heading? What are the main concerns regarding the specialty's future from the trainees' perspectives?
So before answering this, I would like to point out the fact that emergency medicine is still a very young specialty. There are countries who are just starting their residency programs, like Portugal. In a few months, they will have their very first residence in emergency medicine. So I think there is a very hopeful direction emergency medicine is heading on across Europe. And the young generation is not afraid of change and not afraid of bettering their practice. If you look to the presentations we have had during the Congress for the Young Doctors track, there is gamification, there is nurses presenting, there is paramedics doing research and presenting. So it's a very dynamic field, not just because it's emergency medicine, but also educationally related. And the good thing is that all these young kids, and I'm not using pejoratively the term kids, but this young professionals, they come up with a lot of ideas, modern ideas, and they are not afraid to put them into practice. It's also a very good chance for the older educators to keep up with everything and be on top of the situation. Young professionals, they're also interested in environment. They are interested in well-being. It was shown during the that during the pandemic, it was the young professionals who had the most severe consequences of burnout and having to deal with everything at the same time. Being the sandwich generation, you have a lot to do at work, you have a young family to raise, you have older parents to take care of. And it was not the older professionals who felt burned out, but it was the young ones. The question is, how do we support those young professionals to overcome their burnout and to learn how to prevent it in future times? So I think the interest of the young professionals are expanding, both in terms of technological progress, but also paying more attention to their personal well-being and being able to remain into the specialty until the retirement or at least until their age.
Absolutely. And regarding burnout, I mean, it is a systems issue, and regarding the systems part, there's not a lot we can do. However, regarding the personal aspects and the mentality and so on, there's a lot of things I think that can be done in order to improve and especially educate people and give them the tools to make the most out of their situation, make lemonade out of lemons. So has the YEMD done anything on that part, and are there any plans to address the growing burnout concerns post-pandemic?
So there have been also some talks in previous years that were presenting during our track, and we also have members of our section marked in the well-being working group of EUSEM. And there's a webinar we are preparing for next year. But even if you go online, there are a lot of platforms, European and American, that are offering guidance on how to acknowledge and recognize burnout and what you could do on a personal level. And just by accepting the fact that you might be not at the top of your game, not because not intentionally, but because of everything that is happening to you, and even trying to speak out with a colleague and try to ask for help, that is a very important first step. It's okay to take some time off to clear your head, get back to your A shape, and then come back and be an excellent professional. But we need to create this culture of well-being, which unfortunately is not something very popular, at least in our European societies.
And combining, let's say, the educational part with the well-being part, do you think some modules of self-care or self-reflection should be included in some way in the training of young emergency medicine residents? So should either recognizing signs of burnout or actually participating in restorative activities and recognizing it in their colleagues, should those competencies in some way be a part? Could they be snuck into the existing ETRs and such?
Sorry. That is an excellent question, and thank you for that. I truly believe that just as we are learning resuscitation skills and communication skills with our patient for our patients, it's the same with being aware of your personal well-being. It's probably not the first priority of most of the systems, but in order to have a competitive workforce and excellent professionals, you need to pay attention to that. As you have mentioned, it's not just recognizing burnout in yourself, but also in your colleagues, or the other way around. Sometimes it's much more easier to see that someone else is not doing very well, but we fail to recognize or struggle to recognize that ourselves, we are not okay in that moment. Um, it should definitely go into the curriculum as a formal introduction to what well-being is. Also, in emergency medicine, we tend to learn a lot on the shop floor and by example, by seeing what others are doing. And right now, not a lot of physicians are aware that they should be allowed to not to feel burnout. So it is not just the young generation that needs to be trained into recognizing and preventing burnout, but it is also the older professionals that should be supported throughout this process.
Thank you. And now I'll go just a step back and refer to the education part. So a lot of work, as you said, has been done on the ETRs. We now have an ultrasound curriculum that is brand new. Do you think a pan-European curriculum is viable for emergency medicine, given how heterogeneous the systems and the countries are? Like you said, there are systems where it has existed as a specialty for 15, 20 years, and systems where it's going to exist as a specialty tomorrow. So where do you see the place of, let's say, a pan-European curriculum?
That would be an excellent aim to have, but most likely it will not function properly in all the systems. The beauty of emergency medicine is that its main areas will be the same wherever you practice. So the ALS will be the same and the ATLS and everything else. But the particularities of the system you are in will going to make a lot of difference in terms of how you will be able to deliver those protocols. I believe that a generally accepted structure should exist, but more like a guiding structure, not something rigid. And then the national bodies should have the authority to adapt that structure to their own particular setting. However, this process will not be something that will happen overnight because there are a lot of systems that still need to perfect the running of the system itself. And then they will be able to divide their resources towards a standardized educational format. And this is something understandable, especially if you are considering the system that are still under construction. But it is very important to keep in mind that the ETR that is supported by EUSEM, that is endorsed by EUSEM, has been created by a very diverse group of professionals coming from various backgrounds. And hopefully it reflects a lot of the differences we have in all our systems. What we also try to do, and we are planning to repeat in the coming future, we had a survey in 2021 among trainees and young specialists on how satisfied they were with their educational process. And we are hoping to repeat the survey and to be able to measure progress, hopefully, and then see how we can alter the ETR so it will support them better in their educational endeavors.
Excellent. And now I'll just go a step forward regarding the future and innovations. You mentioned gamification, you mentioned AI, you mentioned nurses taking a larger role. So there's a lot of AI around. I mean, you asked ChatGPT what to, where for the conference, what to see in Vienna, and so on. So do you see a lot of EM trainees use AI, and in what ways are they using it the most? And do you think it's a good thing, or maybe we should take a step back before we have some validated practices and agreements on when it's acceptable and when it's not?
So I think we can all agree that AI can be a very helpful friend in all aspects of our life, but if we use it under some judgment. So it might be difficult and dangerous for a very junior resident to get all his information from ChatGPT or whatever or other option there is, because they do not have the knowledge to filter the information the AI is feeding up. However, there are a lot of areas where AI could help our practice, like with those tasks that are very, very repetitive, aiding triage or maybe imagistics, telemedicine, and stuff like this. There is a lot of room for improvement. Also, technology is very, very helpful with the simulation process. And the one good thing that came out of the pandemic was the fact that a lot of the education is now online nowadays. And that means that a European professional could access courses from excellent American universities or from all over the world, in fact. And knowledge has become a commodity nowadays. This will help you gain a very good baseline of information, but then you need to filter everything that AI is bringing on. It might take a lot of years until we have validated practices that could be done by AI entirely. I do not think it will end up there, but it would be a fitting not to use, especially in the educational process, all the tools that the technology has generated in the last 10 years, let's say, and everything makes the educational process much more easier nowadays.
Absolutely. Thank you for the answer. And regarding education being online and accessing the breadth of content that's available, do you, in your practice as an education lead, see the shift from, let's say, a textbook generation to a podcast generation? I mean, we are now recording an educative podcast, so it's obviously something that's trendy. So do you think these people think differently because they learn from different sources? And are their educational needs different from, let's say, a few generations before, from your experience?
So also their needs, but also in terms of gener- uh, being a different generation in itself, they have having access to so much information and tools. They will not go away without an answer, and this is something amazing, something that my generation and the older generation never did. You wouldn't ask the question repeatedly until you actually got the answer. So this makes them somehow courageous and interested in finding out, and they will keep pushing. And if you weren't able to give them an answer, they will Google it up, use AI and everything else, and they will come with an answer the next day, and they will challenge you. And this is, I think, when done in a very respectful way from both parties, this is an excellent learning opportunity for everyone involved. Um, however, I again caution a lot of not restraint, but paying attention to what kind of information sources you are getting. There's a tremendous quantity of the podcast, webinar, and whatever you want to, whatever you're looking for, something is out there, definitely. Um, the commodity of it is that you can listen to a podcast anywhere and everywhere. So if you're driving or on an airplane or walking towards work, and for those who are having a easier time learning by listening, this will be a huge improvement. Some people are just visual learners, and for them, listening to a podcast, it will not make a lot of difference. But maybe they get one idea that afterwards they can look it up in a fashion that is suitable for their learning style, and it will still make a difference. The other very good thing about podcast is the fact that being so international, you have access to various practices. And at first, you might not see the benefit of it, but when you consider the fact that also our patients are not uh, uh, the same anymore in terms of people are moving a lot, you get a lot of foreigners who are working in your own area. You need to be able to adapt yourself and learn a lot about their particularities. And in this way, having access to international information, it will make your practice better.
That's good. And what would you say as, let's say, some kind of a bottom line are the main educational, I wouldn't say requirements, but needs of this new generation that we are just describing? Like, what do they need, what they want from the people, from the system who's supposed to give them the skill, knowledge, and competencies to, in a few years, be independent specialists and our colleagues in the area?
That is a very, very good question. And we just had a whole conversation this morning about this generational shift. I would start with the results of the survey I mentioned before. Residents want more practical educational opportunities, and they want to be engaged and to interact more. And this is extremely helpful. And they basically don't want to have the frontal lectures in the classical fashion anymore. What they also want to have is they need to have the right to reply, to say their side of the story. And the way we give them feedback is extremely important for them. I'm not saying that feedback should be just the positive feedback and we have to praise them all the time, but we need to be able to deliver the negative feedback in a very constructive way so they actually learn something out of it. And this is a form of respect, I would say, to any person you're having that conversation with. And this is how it should happen. In the same time, we should not be afraid of stopping those who are not skilled enough or prepared enough to progress in their training program. And I think that is a responsibility the educators must take, both for the sake of the patient, but also for the sake of the trainee.
And do you see the European board exam as some kind of a, let's say, standardized stopgap, especially for those who maybe haven't learned enough or aren't become progressed enough? Do you see it as something that could be implemented as, let's say, in Malta, where it is the official exam, so there's no national exam, they all have to take the EBM?
I have not taken the exam myself because it is not a requirement in my country, but any standardized form of examination is an excellent opportunity to, even for just for yourself, to have an objective reflection of your performance. Again, as we're talking about having the pan-European curriculum, it will be very difficult to have a pan-European examination structure. The e-beam has been going on for some years, and unfortunately, not a lot of the countries have decided to acknowledge it as an official national certification. But from my understanding of this exam, I think the value of Part B is extremely relevant for what a physician needs to be able to perform. It's complex and it includes all skills, clinical and non-technical skills that you need to possess. This is something that every national society should try to do. It should be within their aim, even if they are not going to apply the standard EBIN, they should try to incorporate as many elements of Part B into their national examination.
Thank you. Now, to round talk, any messages, any take homes for everyone listening? Because I guess, especially the younger people will be listening, the early stage residents. So, what's your message to them?
Well, I would get in here by saying that education is the greatest tool we have if we want to change the world. And with emergency medicine changing so fast and adding up new information constantly, we need to always be prepared. Make sure that you're curious enough and make sure that you are not afraid to ask the questions and don't let yourself be beaten down by feedback badly delivered or by the fact that today you might not be having the best of your days. And just try to take care of yourselves.
Thank you very much. And
It was
see you
my
around the
pleasure.
conference. Absolutely.
Enjoy the conference. Bye.
Good conference.